What's up, you guys? This is Bro Miguel giving you your daily dose of radiation. In today's video, we'll cover most common question asked by respiratory techs to us as X-ray techs. So, out of all the staffing in the ED, respiratory and X-ray kind of go like, they're kind of like, I guess, your brother, your co-worker, like they're your buddy type deal. Because they have a good amount of knowledge, because they have a lot of experience with like looking. I mean, we see all of the X-rays because that's our job. Respiratory, their whole shebang, their whole like main one they care about is chest X-rays, so the lungs and a little bit of the throat, because it's the intubate and do like that. So occasionally they will, like, the most common question is, where's my tube? Can you zoom it in? Is it in the right spot? How does the lung look? Can I see the prior lung? Oh, and then sometimes you like, most of the time, most of us tech over time, like you look at something and you're like, oh, that looks bad. That patient don't look good. Or like the lungs is whited out. And like the respiratory, since like their specialty is their lungs and all the other spiel that goes along with oxygen and blood work and all that, they can look at it and be like, oh, patient has pneumonia. Oh, patient has this disease. Oh, so like you can learn a lot, which we technically as X-ray techs should know. But like the amount of times, pneumo is like the big one that you have to look, because like that's serious stuff. Like patient can die, especially as an X-ray tech. Like that's something, like if you see that one, you're gonna be like, yo, doc, you might wanna look at the expedite type of scenario, because that one can cause severe damage. So you could learn a lot from the respiratory. They go hand in hand, especially like once I said like intubating or the OG tube. That's another big one that they'll do. And they'll ask about like the carotid and like where certain stuff is. And usually what tends to happen is like they'll place it and they'll look at it, and sometimes they'll go get the doctor and bring them in. And because of course the doctor at the end of the day is the top big doc, will kind of give the word. But if the doctor's not there, respiratory is kind of trained to already have known if something's kind of in the right realm of placement of their things they do. And then our job, is once again just to take the picture. So that's some of the most common questions asked by respiratory. And yeah, it's been your boy Miguel. See you on the next one.